Hi, my name is Jim and I was retired. In this video, I'm going to dive deeper into the Affordable Care Act, especially as it applies to those of us in a forced early retirement. If you thought you had selected the most affordable health care plan on the marketplace for 2021, April Fools. The new law, the American Rescue Plan Act, includes new subsidies that go in effect on April 1. Find out more in this video on the new ACA subsidies for 2021. I will begin with my standard word of caution. I am not a financial professional. I have no special initials after my name. So always do your own due diligence and seek out a professional, especially about health care prior to Medicare. For the past few years, I've been carefully managing my retirement income through plan withdrawals and investment income to stay away from the premium subsidy cliff in the Affordable Care Act. On the marketplace, there are subsidies for those of us that stayed between 100 and 400% of the federal poverty level. But if you went $1 over it, you would lose all premium support on the marketplace. For a couple on the marketplace, the income level was about $69,000, and if you had $1 more in modified adjusted gross income, you would lose the premium subsidies. Now, for us, that would mean the healthcare costs would easily double or triple. In March, the American Rescue Plan Act dramatically increased the premium subsidies for the Affordable Care Act marketplace. And for the first time, the premium subsidies go over 400% to ensure that anyone buying insurance on the marketplace would not pay more than 8.5% of their MAGI. And the new law opened up a new open enrollment period to allow people to go back in and buy or switch their insurance plan with these new premium subsidies. As of April 1, the new subsidies should be in the healthcare.gov website or your state's website for its marketplace. So let's look how these new premium subsidies would affect a couple, say early retirees. One is 62 and one is 58. And I'm going to show you on the Kaiser Family Foundation's website what the premium subsidies look like before the new law and then after. Before the new law, say they had income of $68,000, and I've entered in 2 people in the family, 2 adults, 62 and 58, no children, and you submit that, and they were eligible for financial help. Premiums were $557 a month, but premiums totaled for the year 9.83% of their household income. Now, if their income had drifted up just to $70,000, this could have been through a special dividend in one of their investments, easily sending them over the premium subsidy cliff, and they would not be eligible for any help. And in fact, they'd have to bear the cost of $1,912 a month all by themselves. Now, let's see what the new law does for this couple. I'm going to jump over to the current calculator, and I'm going to go back to $68,000 as the income for the same couple with no children on the plan, and submit. And they were eligible for premium subsidy support that brings the premium down to $474 a month for them. And that's 8.36% of their household income for the silver plan. And if they drifted towards that former cliff of $70,000 and submit that, they're still eligible for help at 406% of the poverty level, and in fact, their premium only goes up to $496 a month. So at 8.5% of their household income. So this is a dramatic improvement for this couple. Now, this couple could go in on April 1st, use the new deeper premium subsidies to shop for a plan. Maybe they used their subsidy for a plan that was not so hot, but now with a deeper subsidy of about $100 and so a month, they could shop for a better plan. Or they could decide to take more income, perhaps through Roth conversions. Let me model a couple things here for you. Since the new law allows premium subsidies for those over 400% of the poverty level, let's fill up a 12% tax bracket for this couple, and let's assume that they're going to have income of $105,000 and submit that. Now with $105,000 of taxable income would be $79,900 with their standard deduction as a couple. And they're still eligible for financial help at 609% of the poverty level. And in fact, their cost of a silver plan is only $744 a month because it's capped at that 8.5% of their income. So that's a dramatic opportunity to take more income and perhaps do a Roth conversion. So what if this couple decided to really push the envelope? This new premium subsidy only applies for this year and next. So suppose they decided to do some Roth conversions and fill up their 22% tax bracket. Let's just put in a $195,000 of income, and with a standard deduction that would bring their taxable income down to $169,000. And with that entered, they still get help at 1,131% of the poverty level. Premiums for a month for them would be $1,381, certainly a lot more expensive, but they're still capped at 8.5% of their household income. Rather than paying the $1,912 a month, they're getting about $500 in premium support and accomplishing a Roth conversion. The Kaiser Family Foundation recently held a briefing, and I'll put a link to their briefing on the new subsidies for the ACA. Their briefing also showed that the healthcare.gov website should reflect the new subsidies on April 1st. Take a look at the website then, or the state website for your marketplace. Now, these increases won't be automatically applied. People must log in and update their account. And as you make a new choice this month, it'll go into effect on May 1st. Unclaimed premium tax support for January through April will be settled up with your 2021 tax return. So you have an opportunity here to go in, use these new subsidies starting April 1st to shop for a better deal on health care this year. But before you do, you might decide to do some modeling of your retirement income to see if a Roth conversion makes sense. I did a video about 2 weeks ago on the big COBRA changes in the new law. And if you are eligible for COBRA, or if you're on unemployment insurance currently, do read this briefing and find out what discounts and premiums you're eligible for this year. If you're facing the risk of a forced early retirement, please be sure to like and subscribe to this channel. These are exactly the kind of topics I'm going to be covering. And use the comments below to let me know, are you using the ACA for your health care prior to Medicare? Thanks.